Hello, I'm M Rasmussen from Baylor, Dallas, and I'll be presenting on can subjective symptoms predict objective findings in gastroesophageal reflux patients. These are my disclosures. GERD is estimated to affect a large percentage of the population in the United States and represents frequent ambulatory care visits. The GERD HRQL score is helpful both for screening purposes as well as a quantitative measure of response to treatment. The goal of our study was to determine whether the GERD HRQL score correlates to objective findings in patients undergoing anti-reflux surgery, both to predict when surgical consultation could be warranted and to act as a screening tool to predict objective findings. Here's the GERD HRQL questionnaire. It looks at questions on heartburn, dysphagia, regurgitation, whether or not the patient is on PPIs, and most importantly, whether or not they're satisfied with their current treatment. We used a prospectively gathered database of patients undergoing anti-reflux surgery from 2014 to 2020. The inclusion criteria required a diagnosis of GERD based on a Demeester score of 14.7 or greater, or esophagitis that was seen on upper endoscopy. We also required these patients to undergo a complete comprehensive esophageal workup with manometry, pH monitoring, and endoscopy. An ANOVA test was then used to compare the total GERD HRQL score between different patient characteristics and then verified with logistic regression analysis. In comparing the GERD HRQL score with findings on endoscopy, manometry, and pH monitoring, we found that there is no correlation between the HRQL score and the presence or absence of a hiatal hernia, nor was there a correlation between the HRQL score and the Demeester score or the presence of a motility disorder. What we did find was that the GERD HRQL score, there was a correlation with the presence or absence of esophagitis. As you can see here, the slope of the curve is dramatically steeper after 40. Those with an increasing GERD HRQL score were more likely to have a higher probability of having esophagitis. Specifically, those with a score of 40 or greater had a probability of 42 to 65%. If you look lower on the curve, those with a score of 30 or less, this lowered the probability of esophagitis to less than 30%. In conclusion, the GERD HRQL questionnaire can potentially predict the chances of having erosive esophagitis, specifically in those with the patients of 40 or greater at an increased risk. This may give non-surgical clinicians a better basis to identify patients who are failing medical therapy and allow for prompt referral for surgical evaluation. Thank you, and I'm happy to take any questions.